Doctors are warning younger adults to get screened for colon cancer. According to the American Cancer Society, cases in young people have increased about 2% every year.
And this morning, we're hearing from a 26-year-old currently receiving chemotherapy every 2 weeks for colorectal cancer. Here's ABC Action News reporter Heather Lee.
At just 26 years old, Kylie Patterson is already facing an uphill battle. Before she could even make it to a gastroenterologist, she ended up in the ER.
I thought, oh, she's got ulcerative colitis or irritable bowel disease, but they found whenever they did a colonoscopy that, it was stage 4 colorectal cancer that had spread quite significantly.
A worst case scenario, she now gets chemo for every 2 weeks. For about a year, she was experiencing symptoms she thought was IBS or irritable bowel syndrome.
I think that's why I went misdiagnosed for so long, because I was misdiagnosed as having ulcerative colitis multiple times.
When somebody comes in with these symptoms and they're older in age, colorectal cancer is at the top of our minds to look into. When they're younger, things like IBS are at a higher risk, and so we're thinking more of those types of things.
But that's changing, according to Dr. Brett Armstrong. He's a general surgeon at Advent Health North Pinellas and the director of robotics.
The median age for colorectal cancer is still around 66 years old, but the incidence that we're seeing in younger and younger people is increasing about 2% a year. So roughly 12 to 15% of cases we have of colorectal cancer are now in younger people than expected.
There's no clear answer why. Symptoms of colorectal cancer may include a change in bowel habits, blood in your stool, or constant abdominal pain, aches, or cramps.
If you have any symptoms that persist longer than 2 weeks, I'm talking about any symptoms at all, to go see a doctor.
Dr. Armstrong says symptoms don't always show up right away or at all, which is why a colonoscopy every 10 years, starting at age 45, is so crucial. If you have a family member with colorectal cancer, you should start your screenings a few years prior to the age they were diagnosed.
They start as tiny little polyps. When we can find those early, we can take them out with the colonoscopy and you're done. But when we don't find them early, they grow, they become a cancer, then they begin to have symptoms, and by that point, you're already at risk of it spreading to other organs.
Dr. Armstrong says despite the stigma, a colonoscopy is an easy procedure, and if you need one, he says schedule now, because the Bay Area doesn't have enough gastroenterologists, which means the time between making an appointment and getting the procedure done could be 6 months or more. Saturday, March 3rd is the Check Your Oil event, with classic cars filling the parking lot of Advent Health North Pinellas. It's also where you can learn more about colon cancer and screenings. Heather Lee, ABC Action News.